So this week from IHME, we are not releasing a new set of projections yet. With few exceptions, the epidemic is still continuing to track our forecasts from earlier in the month. The key areas to pay attention to right now are first and foremost what's happening in China with the Omicron wave spreading, most importantly, to Beijing. Many other cities apparently within China also under lockdowns or partial lockdowns. And so as we have been noting for months, actually, pre the Olympics, it's really a question of time when Omicron will spread more widely in China, given how transmissible it is, given the comparatively lower efficacy of the vaccines used in China, and particularly this issue that the zero COVID strategy may not actually work, but our understanding is that the government will pursue that strategy vigorously, at least until the fall. So no real change in expectations there, but simply will be a challenging question as to whether that strategy can hold out to the fall. Second area of concern that people have been tracking has been the steady uptick in Delhi in India in cases. And the question is whether this is due to declining immunity from the prior Omicron wave, or the possibility of one of the subvariants of Omicron fueling transmission in Delhi. They have reimposed their mask mandate, and so we'll see if that has some effect on that one part of India and the surrounding state of Haryana having some increased transmission. Third area of concern is the uptick in South Africa associated with the BA4 and BA5 Omicron subvariants. A steady increase, but not exponential. And again, the question remains, is that because these subvariants are more transmissible, or is it they have immune escape over BA1 and 2, which was there in South Africa and had become the predominant variant? Or is it because of waning immunity just through time? We're now, for South Africa, pretty much 4 months fully, or even 4.5 in some provinces after the peak of the Omicron wave. And then the other main consideration globally around managing COVID, both now, particularly in China, and for the world when new variants that are potentially more severe emerge, is access to Paxlovid. I think we've started to finally see some policy discussion around the importance of availability and access to Paxlovid. IP waivers have been given to 22 countries by Pfizer. And the question is, will there be more rapid scale up in production? And we strongly believe that needs a concerted policy push equivalent to the efforts to expand vaccination. We will certainly expect more from IHME as we run our models in the near future to reflect any new updates in the data as we've been describing.